I am Jamie Cope. I'm the Manager of Business Development at the WVU Industrial Extension, and I want to welcome everybody here to the webinar today. We've got a good one with Randy Kowalczyk, who is our, I'm sure he's got a title that he'll show you later, but in our world, he's just the continuous improvement guy.
That's what they call me.
That's what we call him, yeah, to his face. And so before we get started, I just want to let everybody know that if you've got any questions, feel free to put those in the chat. And if you, we'll probably answer most of those at the end, but if it's something that's really relevant that we need to stop immediately, we'll just stop Randy and have him answer a question. We'll be recording this, and you will get a recording probably early next week along with the slide deck. So if you want to review it later or share it with your friends, you'll have it. And want to encourage everybody to go to wvmep.com/webinars. That's webinars with an S. That's where our upcoming webinars are. Next week, I'm going to be presenting on sincere selling. So we're going to have some fun with that. But right now, I'm just going to turn it over to Randy. So take it away, Randy, and good luck.
All right. Thank you, sir. I am Randy Kowalczyk, and I'm the Manager of Continuous Improvement for the WVU Industrial Extension. The Industrial Extension team is tasked with supporting organizations throughout West Virginia with a variety of needs. I specifically assist with workforce and continuous improvement needs, such as leadership development, training, lean manufacturing principles, job instruction development, and work instruction development, to name a few. I graduated from West Virginia University with a Bachelor's of Science, and I've spent a little more than 10 years in the industry. Early in my career, I was running a forklift and stacking 50-pound bags. But as I gained experience, I had the opportunity to get into management. And then I primarily focused on production efficiency while working with regulatory bodies, helping maintain site security, and explaining technical information to customers on products or processes. Before we get started today, I'd like to remind you of our upcoming webinars we have scheduled. You can find a complete list of webinars and workshops in the events section of our website. All webinars run from 11 to 12 unless otherwise noted, and they are free of charge. It's also a regional roundtable time again, so make sure you mark your calendars for your region's date. And we have 2 more webinars scheduled for May. Sadly, this run of webinars is almost done. But don't worry, nothing heats up the summer season like a WVU Industrial Extension webinar. So we are ironing out the details right now on our next set, and our next series will be sometime in the summer. So what is the WVU Industrial Extension? We are a department of West Virginia University housed in the Sattler College of Engineering and Mineral Resources. WVU is a land-grant university, which means it has a commitment to lead transformation in West Virginia through engagement across our beautiful state. The WVU Industrial Extension fulfills this mission by partnering with small and medium-sized manufacturers in West Virginia to support operational improvement and business growth. WVU Industrial Extension is West Virginia's one and only affiliate to the NIST MEP National Network. This national network has the honor of supporting the manufacturing community and has centers housed in all 50 states plus Puerto Rico. This unique arrangement provides the Industrial Extension the opportunity to support the manufacturing community from a national, state, and local level. The WVU Industrial Extension focuses on developing consulting services that reflect client needs, provide hands-on education, and work one-on-one with our clients. We serve you by delivering practical solutions in the areas of workforce, occupational health and safety, management systems, operational improvement, advanced manufacturing, leadership development, and innovation, growth, and services. I could obviously talk about this subject for hours, but because this is a webinar, I'll just be going over a high-level overview of drug and alcohol awareness and reasonable suspicion. We offer drug awareness and reasonable suspicion training that digs deeper on all these topics and covers a lot of additional content. For today's webinar, we'll go over some relevant statistics pertaining to substance abuse in the US and West Virginia and the impact of substance abuse from the individual all the way to the company level. I will touch on the West Virginia Safer Workplace Act and the basic approach to a drug and alcohol-free workplace policy. And I'll distinguish performance-based issues from ones that require immediate action. In case you aren't sure exactly what substance abuse is, I'll give you the simple definition. Substance abuse is taking a substance for purposes other than its intended use or in excessive amounts. It can be abusing illegal substances such as heroin, cocaine, or meth, or it may be the abuse of legal substances such as alcohol, paint, glue, nicotine, or prescription painkillers. So if the Beach Boys have a reunion show in someone's hometown and they drink too much, or someone passes them a funny cigarette, does that mean they have a problem? Obviously, there's nuance to what's considered abuse, but it's generally considered to be substance abuse at the point where it starts negatively affecting the person physically, mentally, behaviorally, or emotionally, and that still doesn't stop them. So, time for a poll question. What is the ratio of US workers that have a substance abuse disorder? All right, it looks like the voting was a little all over the board, but the majority of people picked 1 in 12. And that would be the answer. The National Safety Council survey says 1 in 12 US workers has a substance abuse disorder. 1 in 12. Now I'm going to say what everybody says when they give a statistic to a group of people. Now look at how many participants we have in the webinar and do the math. I'm sure everybody's heard that a million times, and maybe it's a little cheesy, but it does give you a little perspective. Reasonable suspicion training classes give tools to deal with these complex situations. You can't just look in the handbook and read how to handle the nuance of substance abuse issues. You will have to use your best judgment and navigate with finesse. If a legal battle ensues, it'll help that you have training and a certificate that goes along with it. Supervisors often fear about being sued or having a labor grievance action brought against them as a result of their decision to conduct a reasonable suspicion drug test. These fears can be minimalized if supervisors remember that a decision to require an employee to submit a drug test is not an accusation of drug or alcohol use or an attempt to diagnose a substance abuse or addiction. It's rather a method for ruling out a possible cause or explanation for an employee's behavior that causes concern. Honestly, many of the signs and symptoms associated with drug and alcohol use can be explained with other factors such as fatigue, family problems, physical illness, emotional problems, or other personal stressors. So a lot of people think that can't happen at our company. And I'm going to quote two of the greatest minds of the 20th century. The philosophers Timon and Pumbaa have a problem-free philosophy called Hakuna Matata. It means no worries. Simbo was a young king who ran away from his duties as a ruler of the Pride Lands. He met Timon and Pumbaa and learned Hakuna Matata. Simba followed this philosophy for many years. The only problem is not worrying about anything when you have lions, birds, or even employees to manage will cause some issues. The kingdom was in shambles when he finally came back. There's only one person at a specific company that doesn't have to worry about people not following the rules, and that would be Willy Wonka. Somehow he got the Oompa Loompas to listen to everything he said, work hard all day long, and sing clever songs while they did it. So as far as I can tell, no workers ever disobeyed him at the chocolate factory. So if you're on this webinar, Mr. Wonka, kudos to you. So the stereotype that many people have of substance abusers calls to mind drug dealers, prostitutes, the homeless, criminals. And if that's what you think, here's a few stats on drug use and drinking that might change your mind. 68%, which equals out to about 15 million illicit drug users, are employed full or part-time. Of binge drinkers, 79%, or roughly 41 million people, are employed. And 76% of heavy drinkers, or another 12 million people, are employed. That's 69 million people with substance abuse problems in our workforce. These are national numbers. Comparatively, West Virginia has an above average amount of drug abuse, but we're actually below the average amount on alcohol abuse. Whether the public's willing to acknowledge the problem or not, the reality is that substance abuse is impacting workplaces across the nation, and West Virginia is no exception. In fact, statistics surrounding the effects of drug and alcohol use in the workplace are so compelling that failing to take any action against the problem is as good as condoning substance abuse. So I have a chart showing West Virginia overdoses on opiates over the last 20 years. It's hard to believe that in 1999, opioids were something that we didn't talk about in our state. In 12 short years, overdoses on prescription drugs hit its peak. Around that time, the country realized we had a huge problem, and doctors started prescribing it less and less. Unfortunately, many people who were just taking what the doctor prescribed them for years and became addicted, now they couldn't get a prescription. Unfortunately, this opened a whole new market for heroin and also now fentanyl, which is a synthetic opioid. With the rise of synthetic opioids came a rise in overdoses, a rise that broke the total opioid overdose records in the state and had West Virginia leading the nation in synthetic overdoses by 2017. Fentanyl is so potent that it's hard to figure out how much they're supposed to take, and they overdose. And when I say overdose, I mean to the point that they can't even be resuscitated with Narcan to save them. And in case you don't know, Narcan is used to counteract the effects of an opioid when somebody overdoses. Narcan became more widely available during the mid-2010s, and honestly, without it, recent numbers would be even higher. I was able to get stats from the last couple of years in a recent Charleston Gazette article that I didn't originally have in the chart. In 2019, we had 667 fatal overdoses from all opioids, which was the second year that we actually had a decrease. But after 2 years of decreases, preliminary data shows at least 1,083 West Virginians died of opioid overdoses in 2020, setting a new record for the state. Obviously, it was a time like none of us have ever experienced, but it was still unfortunate to hear. Another rising issue we have in the state is methamphetamine. We had almost a 50% increase in meth-related fatal overdoses from 2019 to 2020, with 569 recorded so far for 2020. This is a more than 1,000% increase from what it was in 2015, when just 49 residents died from the drug, and it's the largest increase that we have in overdoses of any drug in the state. So I grabbed this off of the DEA website just to give you a little visual perspective on how much more potent fentanyl is than heroin. And carafentanyl is 100 times more potent than even fentanyl. So addiction is obviously an issue across the US workforce. And as we already talked about, 1 out of every 12 US workers, which is nearly 9% of all workers, had a substance use disorder in the last 12 months. The table above shows a breakdown of those 9% of workers with substance abuse disorders. Alcohol disorders make up more than 3/4 of these cases. Second on the list is marijuana use, and there is as much marijuana use as there is everything below it on the table combined. But that shouldn't give anyone solace. Anyone who thinks that hard drug abuse is significantly more impactful than alcohol abuse would be wrong. The reality is that all of these things are dangerous for everybody involved when they're abused. According to the National Opinion Research Center's analysis of the National Survey on Drug Use and Health, this is the percentage of workers in each occupation that have a substance abuse disorder. How many of these occupations does your company employ? How about how many of these people do you have on site from outside contractors? Construction and extraction is the highest at 19%. But what about material handlers, maintenance, sales, production workers, technicians, office staff, even executives? I'm sure you have some of these positions, if not all of them, at your company. In each of these positions, at least 10% of employees surveyed have a substance abuse disorder. Granted, just because someone has a substance abuse disorder doesn't mean they're intoxicated on the job. But the problem is that that potential is there. There's a reason they don't call it substance responsible moderation disorder. As the substance abuse progresses, the priority that the substance has in an individual's life increases. The next thing you know, you run down to the gas station for a sandwich at lunch and you see one of your employees hanging out in his car. You walk over and say hi to him, and when you do, you see a gas station cup clearly filled up with beer. And so that there's no doubt in anybody's mind, he panics when he saw you look in his car. So he spends the next 2 minutes justifying why it's okay to have a beer at lunch because he has a lot going on right now. So what do? What can you do? These are some of the things that we go over more in depth during the reasonable suspicion training. The cost to employers of untreated substance abuse disorders is high. So let's look again at our material handlers, maintenance, sales, production workers, technicians. On average, they cost their employers about $8,200 each year. And this chart only accounts for turnover, absenteeism, and healthcare costs. What if the employee's poor quality of work causes you to lose business? What if they smash through a $5,000 garage door or crash into a $80,000 machine? You can just keep adding that to that total cost. As you can see, a few people can have a major impact on the company. So another thing I wanted to touch on that doesn't get brought up enough in a manufacturing setting is bloodborne illnesses. I think with the content I have today, it's the perfect time to bring it up. This webinar pertains to intravenous drug use and talks about substance abuse causing accidents in the workplace. And those two things together contribute to transferring bloodborne pathogens. According to 2017 numbers in West Virginia, there were 76 new cases of HIV, adding to the 1,810 existing cases. There were only 102 new cases of Hep C reported, but the CDC estimates that there's over 20,000 people in West Virginia that already have it. Over 50% of the population, 50% of the people who have contracted it don't know they have it, and Hep C is the most common bloodborne infection. So now who feels like they need some bloodborne pathogen training? I know I feel like taking a refresher course right about now. Unfortunately, accidents can and do occur in a manufacturing setting, and it's important for employees to be trained on how to keep themselves safe if they would ever need to assist a fellow employee that is bleeding. Our health and safety team here at the WVU Industrial Extension can provide that training. So now I want to talk about the impact that substance abuse has from an individual level all the way to the company level. Individuals with substance abuse disorders will develop health issues the longer it continues. They may have no stamina, or maybe they start to look and feel unhealthy. They may not be able to meet the physical demands of their job anymore. Mentally, they may not be able to focus on their family or job. They can always feel tired, or maybe they're in a constant mental fog. Depression or loneliness may start to take hold. Behavioral issues may become apparent through violence, rage, or some people even are just uncharacteristically quiet. Substance abuse tends to cause people to become isolated, with their substance being their #1 priority. Now onto the coworkers. Coworkers can feel unsafe because they are. No one feels to deserve unsafe at work. Decreased quality of work and increased missed work will also cause the remaining employees to pick up slack. We've all had to pick up slack at one time or another, but how would it feel knowing that every single day you go into work with an individual, you'll have to do twice the work, or you might end up getting injured? So how long would you be able to work in a situation like that? Coworkers will become frustrated with the individual and with the company. They will lose trust in management once they realize that no one can control the situation. Coworkers may see that management is doing nothing and just quit. Or even worse, they might hang out with that guy and get coerced into using the drugs themselves. And why not if they won't be reprimanded? Peer pressure in the plant honestly isn't that much different than high school, especially when you have a big group of guys that hang out after work and blow off steam. Individuals with substance abuse disorders are 3.5 times more likely to be in an accident. 47% of industrial injuries are directly related to alcohol abuse or alcoholism. What if these accidents lead to a lawsuit? Also, the number of accidents the company reports also has a direct impact on their insurance premiums. Workers have higher rates of turnover and absenteeism. How much higher? These employees are likely to have worked for over 3 employers in the previous year. And hopefully if they've been hopping around, the hiring team can catch this before they get hired. But you can't work at 3 different employers in 1 year if you don't start somewhere. They can easily start in your plant. These workers are also more than likely to skip more than 2 days of work a month. I previously gave everybody statistics about how many people with substance abuse disorders are employed. And the answer is the majority of them. Drugs are expensive, and I'm sure they'll do their best to at least keep their jobs so they can keep buying drugs, keep buying alcohol. They may not be thriving, but they're fine with just surviving. And if they aren't thriving, how does that affect your production? Quality issues and missed deliveries can have a huge negative impact on customer relations. You might say, well, how many companies would actually let this happen? And the short answer is too many. It's hard to deal with these situations because leaders feel sorry for the person, or they might feel intimidated by the situation to address it. And not to mention, we hear all the time from our manufacturers how hard it is to find people to work. So sometimes you just deal with the devil you know. Unfortunately, not addressing an employee's substance abuse can have fatal consequences. So I'll give you an example of a couple things that can happen. So you can only hope that that impact was strictly material related. Who knows if or how many people were buried under that mess. If no one was harmed, can you imagine how long it would take just to clean this up? Not to mention the damaged material. Obviously, you shouldn't be able to collapse that many shelves by just hitting a couple stacks. They had some other issues that compounded this problem. But once again, somebody under the influence or that abuses alcohol is 3.5 times more likely to do something like this. This was staged pretty poorly, but I think I can get the point across. I want to share a short example. So a company stacks pallets that weighed 1.5 tons, 3 high. It was never an issue. They had a great safety record for decades. No problem until somebody does a poor job of stacking a couple pallets and then buries them behind some other pallets. A group of stacks fall in the middle of the night, and luckily nobody was there. And it only happened once in many years, but that potential is extremely scary. So if someone doesn't directly hit a pallet or knock it over, even the quality of the stack, if the quality of the stack is subpar, you end up with the same result. Things are falling off of the shelves. And I'm talking about sober people making these mistakes. I only added this one because this might be the worst acting job of all time. I'm not exactly sure how the hand truck falls sideways or why he flops on top of it or exactly what injury he's even portraying, but he does have the look of sheer pain down on his face. So I'm going to say a few things about the West Virginia Safer Workplace Act. This entire act is found on wvlegislature.gov. It's not a light read by any means, but if you haven't heard of it, you might want to check it over to make sure your drug-free workplace policy is compliant. Also, the reasonable suspicion training class we offer breaks down this act step by step into something a little bit easier to comprehend. This act became effective in 2017 and made it easier for employers to drug test employees, and it also gives them guidelines to follow if they want to drug test. The only points I'm going to touch on now is that if you do not want to drug test your employees, there is no requirement that you must do so by West Virginia law. If you want to perform a drug test, you must first have a written drug and alcohol policy and communicate it to your employees. And then you would follow the rules laid out in the West Virginia Safer Workplace Act. Another common question is, when can you test? So per the act, within the terms of the company's written policy, an employer may require the collection and testing of samples for deterrence and/or detection, impairment, accidents, theft, or misconduct, to maintain the safety of employees, customers, clients, or the public, maintain productivity, quality of products or services, and also security of property or information. Like I said, the act is long and has more specific rules in it if you want to drug test employees. So I want to cover just the approach to a drug-free workplace policy. The heart of the drug-free workplace policy is the company policy, and this is exactly what it sounds like. It lays out what employees can and cannot do and what action the company will take if they break those rules. Its purpose is to protect the safety and health of employees, customers, and the public, safeguard employer assets from theft or destruction, protect sensitive information, maintain quality throughout the organization, and comply with the Drug-Free Workplace Act of 1988. And that was an act put in place that required some federal contractors and all federal grantees to agree that they provide a drug-free workplace as a precondition for receiving a contract or a grant from a federal agency. So a lot of those right there go right along with what the West Virginia Safer Workplace Act laid out as reasons that you could test the employees. So these go hand in hand with company policies. Training leadership on reasonable suspicion and conflict resolution is necessary to enforce this policy. Employee education is required by the state if you're planning to do a drug test. Employees must be aware of the company policies. Having them sign a paper that says they understand when they were hired and with every revision can go a long way. Drug testing, obviously, is the only way to get any actual proof that someone is under the influence. Without a drug test, your speculation is just speculation. Some companies will help employees overcome substance abuse disorders, but they're not required to. And they put employees in programs called employee assistance programs. DOT reasonable suspicion training for supervisors is required for all personnel who manage one or more safety-sensitive employees covered by one or more of the federal regulations. So this will not apply to everybody, but I just wanted to bring this up so people understand this, what we're doing right here does not count as reasonable suspicion training for DOT. That has to be 60 minutes on the symptoms of alcohol abuse and another 60 minutes on controlled substances. But I wanted to go over this because there might be people out here that don't quite know the difference. So I just wanted to make sure. So companies with truck drivers, they would fall under this. And also airlines, railways, and other transit organizations, but that probably doesn't apply to everybody here. Most common would be companies who have truck drivers. So the way to know if you fall under these regulations would be, do you or any of your employees hold a commercial driver's license or a similar license provided by Mexico or Canada, and operate a commercial motor vehicle in any state? And a commercial motor vehicle, I put everything up here so you could easily read through it, and if you wanted to look back that you could. But a weight rating or a weight equal or greater than 26,001 pounds. Designed to carry 16 or more passengers, which probably doesn't apply here, or of any size that is used to transport hazardous material, which requires the material or the vehicle to be placarded. So if you have any of these, you fall under, you actually have to get reasonable suspicion training. If you just want to get it for your supervisor's knowledge, then no problem. You're not regulated to do so. So I just wanted to put a poll up to see who falls under these regulations. All right, that's what I thought. I figured that the majority of people did not. And I just wanted to go over what a normal drug test would be. Your 5-panel drug test is what a lot of companies use, and that's also what the DOT requires to use. And that goes over your basic hard drugs of meth, marijuana, cocaine, opiates, and PCP. The 10-panel adds in some less used, more exotic drugs. And I also want to put a note in here that hydrocodone and oxycodone, these would be prescription drugs that are commonly abused, such as Oxycontin, Percocet, Vicodin, or Loratab. And sometimes you have to pay extra or get additional testing to screen for these. So just because opiates are on the drug test doesn't mean that your test will actually show these medications as a positive. So this might be something you want to double check whether you're already drug testing or if you're wanting to start a program. So there's two situations that you encounter when you address employee substance abuse issues. Performance-based issues cannot be immediately tied to substance abuse because you don't have any actual evidence that is substance related. These would relate to production, such as missing deadlines or consistent poor quality, attendance issues becoming more frequent, or a change in attitude that is extreme or for a long time. These issues could be caused by personal issues, work-related stress, or honestly, somebody that's sick of their job. But that's why documentation is important in these situations, even if you don't immediately think it's drug-related. If somebody has performance issues for 6 months, but you never document anything, how easy is it to discipline that employee? can you fire them at this point? If you wanted to send them for a drug test, what grounds do you have to stand on? And there's also immediate action. Immediate action is a little bit clearer. It's required when you have reasonable suspicion that an employee is under the influence at that moment, an accident occurred, or an employee gets violent. In this instance, the intoxicated employee is an immediate threat to the safety and well-being of other employees. So you would need to follow your company policy to send the individual to take a drug test. So to summarize today's webinar, we learned some concerning stats pertaining to US and West Virginia substance abuse and its cause. We also covered the impact of substance abuse from individuals to the company level. We went over the most high-level points of the West Virginia Safer Workplace Act and also the approach to a drug and alcohol-free workplace policy. Finally, we covered the differences between performance-based issues and issues that require immediate action. All right, do we have any questions?
Great job, Randy. And at this time, anybody who has any questions can put them in the chat. And I've got a couple here, or one at least. So go ahead and put those in the chat if you've got some questions. And I forgot in the beginning to give a big shout out to HADCO. We're coming to you, I'm coming to you from there anyway. So always nice whenever our manufacturers and partners let us use their facilities to do these things. So thank you, David Living and the whole team there, Adam and Donna at HADCO for letting us crash here today. So Randy, I did have a question here. Let me. What content is covered in the reasonable suspicion training that the WVU Industrial Extension offers? So yeah, if you're going to do this as a class, what would you cover that's different from what we covered today?
So we do a deeper dive into the drug and alcohol-free workplace policies. And also, I think I said in the presentation, the West Virginia Safer Workplace Act. I mean, obviously, it's an act of legislation, so sifting through that was a whole lot of fun, but I do have that broken down so that people can actually digest it. And then there's a whole section on the signs and symptoms broken down for each of the drugs on the 5-panel drug test and for alcohol on signs of abuse. So whether it's immediate signs of abuse, whether it's some long-term signs of abuse that you can actually look for. And that's part of the DOT training. So it's a condensed version. I don't do an hour on both of those, but I could obviously do that if somebody needs it for DOT purposes. And we go over leadership, the responsibilities of leadership, and also what is not the responsibility of leadership.
Okay.
And we go through a nice chart of do's and don'ts, and we also have how to deal with employee intervention and some tools that you can use to deal with those tough situations.
Great, great. And as far as that West Virginia Safer Workforce Act, if you want to send that link to me, I can include it in the email that I send out with the recording and the slide deck so that everybody's got it in case they have trouble sleeping at night and they want to read through it, right?
Yeah, perfect. I have the link for it, so.
Okay,
I think
cool.
that's a great idea, Jamie.
All right. And looks like Cindy has a question here. How do you get set up with a facility to drug test?
We just basically called a facility. So one of the things that people think that you can do is just kind of willy-nilly hand out drug tests, but the rules laid out within that Safer Workplace Act make it so that it would be smart to get lined up with somebody who does that. So, I mean, at my previous employer, we actually used MedExpress. So we just did an urgent care. They were open 7 to 7 every day. So that way they covered our working hours so we could send them whenever we needed to send them. And there would be no delay or anything like that. And we basically we talked to them and set that up so that it was something that we did. And whenever we had somebody that needed a drug test, we would send them in. We were under DOT regulations, so we had truck drivers that had to go and meet the random drug test quota every month. And that's all we did. We just sent them right up there and they made it easy peasy.
Okay, great. So yeah, and it's almost always a third party that you're dealing with that, right? It's not a kit that you use on site, I guess, or?
No, we send them along because, like I said, when it comes to these things, they are very, very sensitive. And there are plenty of rules you have to follow to make sure you don't end up tainting that sample. And
Sure.
it's a lot better if you just have somebody go and have a professional take care of it.
Perfect. Perfect. Well, I'm not seeing any more. Oh, wait. Oh, somebody else says they were set up with Med Express and they're now LabCorp. But when we use them, they would not. They wouldn't give the results due to HIPAA. How do you get around that?
We used a third party in Pittsburgh that also took care of our drug test. So we didn't have to figure out who needed to randomly go. We let this third party take care of it. So if I'm allowed to divulge that third party, maybe we can throw that in the email. I don't know what the rules are on that. It was a third party up in Pittsburgh that took care of setting up your drug testing, basically. So we would send them to the drug test, but that third party would get the information and then they would keep all of those records on there. So you could just go to the report and open it up, print it out, and then put it into, well, we had to put it into DOT files.
Sure, sure. And it looks like David says that they use LabCorp now and their results get emailed to their corporate office for review.
Well, there you go. So LabCorp might be the way to go.
Okay, okay.
But I have no experience with that.
Yeah, yeah, and yeah, and Lee asked again, is drug screening covered under medical privacy? So maybe if we dig in and find some answers to those questions, we can send those out in the email as well, or if you want to.
Yeah, I can dig into that.
Specifically, have him give some more research to it. That'd be great. We're happy to do it. And I also got a personal message from Willy Wonka. He couldn't make it today, but I'll be sending him the recording. So we're all
unfortunate.
Yeah, yeah. All right. Well, if nobody else has any questions, I want to thank everybody for coming, and great job, Randy. As always, I learned a lot. And we'll see everybody next Thursday with our next webinar. If you get a chance, check out wvmep.com/webinars and you can register there. So thanks, everybody.
Thank you, everyone.